Hello everyone, it's me here. So I just wanted to do a little, update video on the coronavirus and what's going on. Possibility of lockdowns are coming. If you go outside right now in your state, at least in my state in Maryland, a lot of malls are closing. A lot of shopping stores, general where you would go buy clothing and such, are closed. Banks are closed, some of them. I guess the ones that are, I don't know the technical term of the banks, but they're not like open to the public generally. They do like investment banking, I think. A lot of the investment banks are closed anyway. So Starbucks is closed. I'm in the parking lot right now looking right across at Starbucks, and they limited their hours, which is a strange thing when people need coffee in the morning, so they're not even open yet. I don't know if they're actually going to open during the day. I know the Starbucks over in Korea and China and all those other countries ended up closing. And basically the places that will obviously be open if they decide to do a general lockdown would be the grocery store, any grocery stores, gas stations, hospitals, of course, and a lot of doctor's offices might close. A lot of doctor's offices that I've been coming in contact with lately actually switched to doing televisits. So if it's not anything super important, you can get an appointment that way and do these televisits. Also, if you think you're sick with COVID-19, you're supposed to call them, tell them your symptoms, and hope that they will actually give you a test, because with most people, they're not. When they could very well be infected and infecting other people. But, I guess they just want to save the test for people who are literally in the hospital dying. And at that point, I would say they could do an x-ray and look at the lungs and say, we have pneumonia. Look at the, it's the way that the pneumonia is acting with COVID-19 is very specific on patterns, basically. So they can easily look at that. I understand if you're not severely sick and you haven't developed pneumonia, they're not going to be able to tell just by looking at it. So I don't know what they'll do with that, but I think they should be testing a lot more people because, we do have the problem with asymptomatic people. One scientist was saying that approximately you take the number of cases you have in your country or your state. In my state currently, last I checked, we're at 60. So you take the 60 and you times it by 40 or 20, and that's how you get your real numbers. And with that estimate, we're saying our 60 for easy math, we can round it up to, but either way, we have thousands of people that are walking around infected and don't know. So social distancing is important. I think the closure of a lot of these stores is important, and it's very scary. It very well is. It terrifies me. I will still have to go to work no matter what. There could be a tornado outside the door and I still have to go to work. But it terrifies me, and so I understand people are going to get very scared. People are going to get very worried. I'm sure that everybody's going to need a therapist after this. I was talking to a therapist I knew yesterday, and I said, and I won't lie to you guys, I'm having so much anxiety about this. I'm terrified. I don't know if you could tell right now that the look on my face, I'm terrified. I don't want to get sick. I have an autoimmune disease. I have asthma. I'm worried that I might be one of those people in the ICU. I might be one of those people who end up being intubated. I might end up being one of those people who are on the ventilator. Or I might not. I might end up getting a touch of it, just like the common cold, and being okay. That's the weird thing about this disease. It does target older people the most, which is what we're seeing in America. I don't know if they're just targeting testing older people or if it really is affecting older people. I think that's what we're seeing in Italy as well. Italy has a huge population of older people. Italy is actually one of the countries that's trying to get the younger generation to have more kids. Now, we all know Italians live very long. I guess it's the cup of wine that they drink every day. Italians live very long. But a lot of the people in Italy are dying are the older people. So that's why you're seeing such a real high death rate. And I say kudos to Italy for everything that they're doing, because right now I can't even talk. The epidemiologists are saying that they think within the next few days, Italy is going to reach their peak of infections, which means after they reach their peak, slowly things will go back down. So we're going to have a better situation there. And in America, we need to watch. We need to see what they're doing over there. We need to follow suit and do the same things that they're doing, as scary as it may be. We can't let our medical system get overwhelmed, because the best insurance can't save your life if you don't have a doctor who can spend that time with you. If your doctor is divided up by 20 other patients or 100 other patients, there's going to be things that are going to get missed. There's going to get doctors who are going to be sick. So I know there is 2 different strains. So if this doctor is sick with the L strain and then you as a patient are sick with the S strain, this doctor could infect you. You could infect the doctor with the, vice versa, and have them both at the same time. So that's where this gets very scary. Very, very scary. That's why if you've heard some doctors, if you watch Dr. John, he's a doctor based over in England. He's a very great doctor. He's very well at explaining things on layman's terms. He talks about slowing the curve. So basically what that means, when we have a bunch of people getting sick, so I don't have a pen and paper, but we'll use my finger as, okay, well, let's see, like this is, okay, there we go. So this is the peak. This is where the cases go up, and then the middle in between my fingers are the peak, and then this is where the cases drop down. That's the peak right there. You see in between that high amount of patients that are sick? That's say we have 100,000 patients sick at one time, where if we are able to lower the curve, so let's say I spread it out, we might have the same amount of patients who are sick, but it's over less time. So say maybe we go from 100,000 patients sick at one time that are needing ventilators to maybe only 10,000. That's what we have to do right now. And that's what we got to hope for the best. I mean, this is just one of the craziest things I've ever seen in my life. I think most of us in America, this is the craziest thing we've seen. Yes, there was Ebola. Yes, there was SARS. There was MERS. I don't believe we had any cases of MERS in America at all. I know we had a few cases of Ebola, but the cases of Ebola we had were actually from doctors who were helping out over in Africa and came back infected. We did a very good job at treating Ebola. We also helped out some of those African countries. We did a great job at that. So in America, let's hope that we're able to follow what Italy is doing, because it's scary. I mean, we have such a massive population. And yes, we have a lot of hospitals, but we don't have the amount of hospitals that we should for our massive population, especially when we have so many people in America that have underlying heart diseases, have diabetes, they have autoimmune diseases, asthma. I mean, we are a country that smokes a lot. And there's so many people smoking. I have noticed a decrease in people smoking. So that's a really good thing, because some people are getting worried about this coronavirus. So a lot of people have stopped smoking as much, and that's a very good thing. I used to smoke as well. I stopped back in like November because I had got a severe flu back in November, and I stopped right before I got the flu, actually, like 2 days. I was like, I'm done with it. And then I got the flu. So I haven't smoked since then. And, sometimes I get stressed out and I think, oh, I'm going to do it again. But this coronavirus sure as hell makes me not want to, because I need to get my lungs capacity back. Like I said, I do have asthma. I have an autoimmune disease. It's not known yet if the autoimmune disease is affecting my lungs. There's a possibility of it, but they're not sure. But, I'm just trying to make sure that it doesn't. So whenever I see someone out there smoking these days, I'm yelling at them. I'm like, hey, quit smoking. There's coronavirus out. And they probably think, who is this nut job? Yes, I'm a nut job. I know it. This whole thing terrifies me. I never thought that I would live to see something like this in my life. I mean, I've seen this happen over in China, but never I thought in America we would have something like this happen. And the fact is, I guess that's the American privilege to think my country is so great that we would never have something like this happen. But the fact is, no matter where you live, this can happen. It can. There's these crazy outbreaks, and I personally think as more and more the earth gets overpopulated and more, people live in close proximity to people, and global warming, which we won't get into a long story about global warming, about my views on global warming, but it is happening. We can agree that it's happening, whether you think that it's natural or it's not, and we're making it happen. We could touch on that in another video, and if you want, we can discuss it in the comments below. I don't care, but I'm not going to go into a rant about that, because we know my rants could last 25 minutes. So, but I do think that these are things that's going to happen way more and more. So anyway, I just wanted to give a touch up or update on all that stuff right now. And if you have any comments, feel free to leave them down in the description box. I'm probably going to try to do some of my usual videos this weekend. I'm trying not to focus on this too much, and I advise for everyone, try not to focus on this too much, but make sure you're taking the necessary precautions. But it's very hard not to focus on it. It's very scary. And to tell you the truth, I'm fucking terrified. And most people are like, oh, you're being dramatic, whatever. But, I just don't want to get sick. I don't want my family to get sick. But the odds are, before this is all over with, let's hope that the heat from the summer, can maybe kill this virus down. There's been studies that say that won't happen. But I'm still hopeful. I'm still hopeful. And in America, we just got to follow suit. We got to do what we got to do. We got to look at what these other countries are doing, and we have to just make sure everyone is tested. So if everyone has to go on a mandatory, shutdown, I don't know how exactly that would work. But like I said, I know how that would work, but everyone except for hospitals. I think at one point that's what China did. Hospitals were the only thing that was open. They shut down pharmacies in China. They shut down all doctors' offices for anything that wasn't necessarily important, and treated everyone for coronavirus. Everyone, basically. All the doctors focused on that. And that might be what happens here. We might have doctors who have no clue what a respiratory therapist does, or a respiratory doctor. I forgot what their technical term is. We might have OBGYNs trying to save you because you can't breathe. And that's okay, because these are medical professionals. You got to make do with what you have. But this is the importance of slowing the curve, social distancing, so we don't get everyone sick at one time, so we can have the proper doctors taking care of you. That's what we need. And as you could tell, they just actually sent an email out. I don't know if a lot of people watching this might have gotten them yet, but it's about a company that's based in Atlanta, Georgia, by the CDC, right? By the CDC. CDC, I think, is getting them to send anybody who's a retired doctor or not practicing in something that they went to school for. So say you started going to school for being a nurse, or you're a medical assistant and you're not practicing in that thing, or you are a retired nurse or retired doctor. They're asking everybody to come back. They need your help. So they're already asking, so they're anticipating, and I'm grateful that they're going ahead and reaching out to these people. Right now it's a sign-up sheet, and you sign up and you say, yes, I will help. And me personally, if they said they needed me in a hospital because of my immune compromised system, I'd be terrified. I'd rather them use me on law enforcement. Give me a squad car. I'll drive around making sure everyone's following the law. I'd rather do police work if they needed me to than sit there and being in the hospital because of my immune disorder. And someone said to me yesterday, oh, well, this is the profession you chose. You're going to be around sick people. Yes, but also when I chose to do this job, when I was 16 in school, like taking college classes at 16 and all that, I did not know I was going to have an immune compromised body. I did not know I was going to end up with autoimmune disease. Yes, I had asthma. But a lot of people in my family do. But anyway, that was the dumbest thing somebody said to me. But the same person keeps saying dumb shit all the time, and it's just really pissing me off, from the point of they don't even believe any of this is true. And this is a fellow person in the medical field. They think it's just all made up by the government. They think it's made up. Why would the world make it up? I know there's conspiracy theories out there, but I totally know there's tons of conspiracy theories out there. And I'm not going to bother to even touch on that now. I don't want to touch on any of the conspiracy theories, I think, until after this is all over and done with, because I think it's very disrespectful if I do touch on them now. What some people think, what I think, you know. But guys, I guess I just want to say, go ahead, be safe, try to take your precautions, try to stay away from people, and if you start having any symptoms, try to call your doctor and hope that they will give you a test. Hope that they will. There's a criteria and guidelines, and one is still, have you been outside of the country to an affected area? No. Have you been to a heavily infected area in your country? So in other words, that would be New Jersey, New York, Seattle, or Washington. Seattle, Washington. I don't know why I always say Seattle as like that. Anyway, and California. If you say no, they're going to say, okay, odds are you don't. Monitor yourself for symptoms. See if you get better. And if your symptoms get worse, give us a call back, and then we'll see from there what the situation could be. So I just thought I'd put that out there. All right, guys, please, everyone, be safe. Take care of yourselves. And I wish you all luck. Bye.